My name is Elizabeth Salisbury Afshar, and I am a family medicine and addiction medicine physician. I initially went into the field of addiction because I was working in Baltimore City. And in my work there, I started to realize that every patient that I was seeing had been impacted by addiction in some way. And started to learn more about addiction treatment and quickly realized that the tools that we had, particularly in the case of opioid use disorder, medications for opioid use disorder were highly effective and were just as effective as the medications we use to treat other chronic conditions.
But there is a need also now for some kind of CPR-like opportunity for people who have overdosed on opioids. And especially if someone lives in your house who's prescribed opioids, if you have friends or acquaintances who are substance users, or perhaps even casually when you're on the street somewhere, you'd see someone who has overdosed. And naloxone is the drug that has been approved for this purpose. It's available in a number of very convenient little kits, such as this. You can carry it in your pocket or your purse or your satchel. It doesn't weigh more than a half ounce. It's not toxic, it's not illegal. And should you accidentally give it to someone who's unconscious for a different reason, it's harmless. So this is a way to do CPR on opiate overdoses. In Illinois, you can go to a pharmacy and buy naloxone without a prescription. And in other states, you would probably find most doctors who would be willing to prescribe it for you.
I treat addiction because I believe people deserve a chance to get out of a trap they've fallen into. This is a trap that people oftentimes don't realize is closing in around them until it's too late, and a trap that industries sell. We don't see people selling depression, we don't see people selling anxiety, but people sell addiction for profit. And that's something that as a healthcare professional, I want to make sure that I'm on the side of the people who are suffering and the people who are hurt by this, to try to not only raise them up, but stop this from ever happening again.
Hi, I'm Ruchi Fitzgerald, and I'm an addiction medicine clinician and a family medicine clinician. I'm speaking today in honor of International Overdose Awareness Day, which is a call to action day for me and a chance to remember those who have lost their life to opioid overdoses and other drug overdoses. Today is a really special day for me. It's important to listen to those who use drugs and understand that they are important, and really have an opportunity to teach me, an addiction medicine clinician, about the importance of harm reduction and the use of Narcan.
Most of us have things that we struggle with. And we know that it's hard to make changes or fix something, whether it's an addiction or something else. But that can help us really empathize and understand the struggle that people go through with an addiction.
Addiction is a chronic disease and one that is treatable. There are treatments available to end suffering and promote full and satisfying lives. The Illinois Society of Addiction Medicine is dedicated to increasing treatment access, education of addiction, and awareness of how to prevent opioid overdose deaths. This includes increasing access to naloxone so we can prevent needless overdose death and save lives.
Naloxone, how to reverse an opioid overdose. We need it not just in the hands of people who are at risk, but in the hands of their loved ones. We need to be educating everyone who could be around and present at an overdose event so that we can keep people alive long enough to get them help.
Hello, I'm Dr. Celeste Napier, and I'm a professor of psychiatry and behavioral sciences at Rush University in Chicago. I'm a neuroscientist with a PhD in pharmacology, and I studied the effects of opioids on the brain building blocks, cells called neurons. Decades of laboratory research has verified the safety and effectiveness of naloxone to reverse the effects of opioids like morphine, heroin, and OxyContin. Overdosing with these opioids can actually be a cry for help by those who suffer from opioid use disorders.
All right, hi. Steve Holtzford here. I'm just about to leave the house. run some errands, then go to work. So I'm just getting my things together here. And let's see, let me get my briefcase. All right, got my phone charger. And most importantly, got my Narcan. Carry with me everywhere, in my glove box, in my briefcase, because you can't get better if you're dead.
This time of the year, it's time for us to remember those who die from opioid overdoses, those who are hurt by opioid overdoses and other overdoses. But let's go further than that. Let's work to prevent addiction. Let's work to protect our young.
As we observe International Overdose Awareness Day, I think it's really critical that we remember that opioid overdose deaths are completely preventable. So many of my patients who end up being incarcerated because of their drug use and witnessing the trauma and the disruptions that that incarceration has. So I think it's time that we really start asking critical questions about, if we're going to talk the talk, that addiction is a chronic condition, we need to walk the walk and treat it that way.